Earlier today, Dr. Anthony Fauci gave his final press conference as part of the National Institute for Health. White House spokeswoman Karine Jean-Pierre had this to say about Dr. Fauci.
For close to 4 decades and under 7 Republican and Democratic presidents, Dr. Fauci has always led with the science, and our country is stronger and healthier because of his leadership.
Before leaving, Dr. Fauci took questions from reporters and also gave America a final message.
My message, and my final message, maybe the final message I give you from this podium, is that please, for your own safety, for that of your family, get your updated COVID-19 shot as soon as you're eligible to protect yourself, your family, and your community.
Not everyone shares Dr. Fauci's passion for more vaccines. In fact, last week, a bipartisan vote in the Senate voted to terminate the COVID-19 national emergency under the National Emergencies Act. While this resolution has not been brought to a vote in the House, President Biden had said he would veto the resolution if it reached his desk. Is Congress correct that the COVID emergency is over? Will anything change without Dr. Fauci's presence? Joining me now to discuss this is Dr. Bhattacharya. He's a professor of medicine at Stanford University and one of the authors of the Great Barrington Declaration. Dr. Bhattacharya, welcome to the program.
Good to be here.
Well, what are your thoughts on Dr. Fauci's final press briefing today, as well as just his departure from the National Institute for Health?
I mean, it certainly is an end of an era. I think he's been there for 38 years. Both good and bad. He's led the NIAID, the National Institute for Allergy and Infectious Disease, for quite a long time. And they've done a lot of interesting research, under Tony Fauci's, sort of leadership. At the same time, I think any honest evaluation of how he's done during COVID, you have to say that he has not succeeded. A tremendous number of people have died from COVID. The interventions that he's put forward, the lockdowns, the school closures, the vaccine mandates have created tremendous distrust in public health and have not protected vulnerable people from COVID and have caused tremendous harm to the life prospects of children, for the poor, the vulnerable, the working class. His advice has turned out very badly, and I think that will mark his reputation forever.
To that point, I am under the impression, though I cannot cite where I saw this at the moment, that about 5% of Americans have received the latest COVID booster vaccine, which seems to suggest that people are either indifferent to the CDC guidance or simply unaware of it. Do you think that there is a credibility problem now between the American public and our health officials?
I do. I think there's a credibility problem. I think the vaccines were oversold. People were told by Tony Fauci that if you took the vaccine, essentially that the disease would go away. The vaccine doesn't stop you from getting infected. That was very clear early in 2021. Certainly by May 2021, that was abundantly clear. And people stopped trusting public health when public health oversells the evidence. The White House spokesperson said that Tony Fauci had led with science his entire career there. Actually, that's not true. The science did not show at the time that the vaccines would stop transmission. I believe that vaccines were useful for protecting vulnerable older people against severe disease. But even if you got the vaccine, you could get COVID, and they did. And people saw that. And I think that the trust in public health is at an all-time low. Certainly in my own career, I've never seen it lower than it is at this moment.
Well, at his press conference today, Dr. Fauci continues to fight, it seems, the COVID virus. Here's what he had to say about the current threat posed by COVID. Let's play clip 6.
The real danger is in the people who have not been vaccinated. So that's where we expect, if we're going to see a problem this winter, it's going to be among those people.
Dr. Bhattacharya, do you agree with that?
I mean, I think the vast majority of the American population, 90% more, have already been infected and recovered from COVID. They therefore have, even the unvaccinated, that's true, but both vaccinated and unvaccinated alike, that's true. So that means that they have pretty good protection against severe disease, even on infection. And Omicron itself, the variant that's currently floating around, well, that variant seems like it produces milder disease. So if he means that the unvaccinated face a severe danger, well, what you should distinguish unvaccinated who've never had COVID before, have managed to hide themselves away forever and never got the vaccine. Yeah, maybe. And if you're elderly, maybe that makes some sense. But for the vast majority of people, even unvaccinated or vaccinated, they're protected by dint of immunity from COVID, based on COVID recovery. They've had COVID and recovered, and therefore have pretty good protection. It's a vast overstatement based on no evidence.
Dr. Fauci has become a household name, of course, in America, and he is self-described as a representation of science itself. Now, of course, somebody is going to fill this role. Any idea who that's going to be, and will it matter?
It will absolutely matter. And I don't think I want anybody to fill the role of science itself. That no one should have the ability to say, unironically, that if you criticize me, you are not simply criticizing a man, you are criticizing science itself. There is no high pope of science. It is absolutely, it's absolutely a mistake to ever designate someone as so far outside the bounds of criticism that you can't that he can say whatever he believes as science says, and everyone has to just go along with it. Science involves questioning. Science involves the development of evidence and then changing your mind in the face of that evidence. He has not done that. In fact, what he's done is through all through the COVID pandemic, what I've noticed is that he has made statements at odds with the evidence from on high and expected everyone to go along with him. And distressingly, very large parts of public health have done exactly that.
We're all very familiar now with the debates over the science and the different parties, the different sides of that debate. Now that we are almost 3 years into this, what's your advice to the American public? Because people don't want to get COVID. People don't want to get their relatives sick. They want to avoid sickness themselves. But as you point out, there is a credibility problem. People don't know who to trust. What are you telling people they should do, if anything, now?
At this point, my advice is, unless you are deeply immunocompromised, and for whatever reason the vaccines haven't taken, and you've somehow managed to avoid getting COVID up to now, except for that very small fraction of the population, I tell almost everybody else, live your life. It's far past time to stop thinking that the avoidance of a single infectious disease is the sole purpose of your life. You're hurting yourself if you hide yourself away from your grandkids, your children, your interactions with others. It's time to start living much more normally than we have the last two and a half years. It's time to stop living in fear. The vaccines and the fact that you've had COVID and recovered protects you. There's no guarantees in life. You could get COVID, but the death rate from COVID is lower now per infection than it has been through the entire pandemic, at levels that are in line with many other risks that most people are willing to take, the vast majority of people are willing to take in their lives. So my advice is to most people, the vast majority of people, is live your life.
Yeah. Even before COVID, we would occasionally see people in the airport with a mask, right? And of course, mask wearing became very common during the COVID pandemic. And now most people in public, anecdotally, are not wearing masks, but there are a handful who still are. What do you think is anything, for those who are currently still taking precautions, is anything going to be different, say, 2 or 5 years from now than it is today?
I mean, I think there may be a small minority, a very small minority of people who continue to wear masks. But for the vast majority of the population, 5 years from now, it'll be a bad memory. Yeah. And as we look back and evaluate the effectiveness of the advice to wear masks, I think what we'll find is what we've kind of already found in many scientific studies, that this advice actually was counterproductive. It did not work to protect people from getting COVID. It divided the population along these lines that should never be divided politically, certainly in terms of public health, but also it divided people into this sense of, like, this I'm empathic, I'm trying to protect you by wearing my mask. We moralized the wearing of a mask. Right. I think 5 years from now, we're going to look back on that as a black moment in public health, a dark moment in public health, where we overstated the evidence about the efficacy of this intervention, and then allowed it to be politicized and moralized, and as a result, diminished the authority and the trust by the public in public health.
Do you think the health risk from COVID will be less in 5 years than it is today?
Yes. Yeah, I think so. I think the key thing is that when you get COVID and recover, it provides immunity in the sense of uh, certainly protection against reinfection until a new variant comes out, and also protection against severe disease on reinfection. And it's just like the other coronaviruses, I think at some point it'll look like. The other coronaviruses you got when you were little. You didn't suffer too much for it because you got it when you were little and your immune system was good at dealing with new things. And then you got it again when you were 6 years old or 9 years old or whenever, repeatedly over your life. And now all those other coronaviruses are simply a common cold because so much of the population has had prior exposure to it. I think the same will be true for this virus. At some point, we'll just think of it as another common cold virus. The problem in 2020 is that it met an immune naive population. 5 years from now, and certainly even now, we're no longer an immune naive population.
Republican leadership in the House of Representatives, which will now be the majority come January, they have said that they will use their majority to investigate the decisions that Dr. Fauci made. He was asked about that today during his press conference, and here's what he had to say. Let's play clip 3.
But I've testified before the Congress a few hundred times, okay, over the last 40 years or so. So I have no trouble testifying. We can defend and explain and stand by everything that we've said. So I have nothing to hide.
Dr. Bhattacharya, what's your reaction to that?
I'm glad. I'm glad he needs to answer a very large number of questions. I hope he answers them honestly, because if he doesn't, then the American people will continue to lose trust in public health. He owes the American people an answer about the decisions he made to fund gain-of-function research that was conducted in a Chinese laboratory where the epicenter of the virus started. He owes the American people an answer to questions about his management of the pandemic. Why did he recommend lockdowns? Did he actually think that lockdowns worked? Why did he recommend school closures? Was he aware of the harms done to children as a consequence of it? Why did he recommend vaccine mandates? Was he aware at the time that the vaccine didn't stop transmission? I think a lot of questions he needs to answer. I have to say, I think he owes the American people those answers, but what I've seen through the pandemic is that he is unable to come to terms with the fact that his own advice has failed, and he often makes excuses for it. The final word on this will require him to answer, but it will not be his answer that I think will be the final word. It'll be told by people who were harmed, especially the poor, by the vulnerable, and children who were harmed by the advice that he gave.
Well, there are members of Congress who are eager to ask questions, and at least if today's any indication, he seems eager to provide them. And you've mentioned some of the questions that you'd like answers to. Do you think there's anything currently being done that is a mistake?
Well, I think the booster, so you heard the recommendation that everyone should get boosted, more or less. Well, I think the advice needs to be much more subtle than that. If you've had COVID and recovered, you probably don't need a booster. Maybe if you've never had COVID, somehow you've escaped it, and you've had 2 vaccines but not the booster, maybe it's worthwhile. I think, but I don't know the answer to that because solid scientific evidence has not been developed to say that one way or the other. I think the biggest mistake still being made in this pandemic is that the CDC and the NIH and the American Public Health is flying blind instead of demanding and creating studies to answer key questions. Who really needs to be boosted? Will N95 masks at scale work to protect vulnerable people? I mean, there are lots of questions that I guess in principle you could answer with high quality studies. Instead, what we've seen is low quality studies, extrapolations far outside what the scientific evidence says, moralization. I think we're still seeing that to some extent, the politicization of public health. All of those, I think, are still mistakes that are being made and should be corrected.
Dr. Bhattacharya, final question. I mentioned in the opening that a bipartisan group in the Senate voted to end the COVID emergency powers. President Biden said he has opposed this and he would veto it if that got to his desk. Do you think President Biden still needs emergency powers after almost 3 years in about 45 seconds?
No, he does not need emergency powers. Any powers that he's currently using for the COVID emergency would better be handled by normal democratic processes. He is not a king, he's a president. He should act like one.
Well, we actually see right now that Justin Trudeau up in Canada is having that same debate with his people. The accusation that he is a king, that he is a president, or in that case, a prime minister, rather than a president. But that lust for power, perhaps it is not easily given up. But Dr. Bhattacharya, we appreciate not just today, but over the last several years, you have been a voice of reason for a lot of us as we have tried to sort through the confusion and the fog of this. And we appreciate your courage, which it certainly took throughout much of this, and your time as well today. Thanks for being with us.
Thank you.